Alabama hospitals are losing money at an alarming rate. That's according to a recent study provided by the Alabama Hospital Association.
So the data shows that Alabama hospitals lost more than $1 billion since the pandemic, causing an immeasurable financial crisis. News 19's Archie Snowden takes a closer look at that study and joins us live with more.
Now, guys, these financial losses have been tracked for years, totaling billions of dollars, as you mentioned. But in 2022 alone, Alabama hospitals lost over $700 million. It looks like this trend is going to continue, but whatever that trend is in 2022, that will continue. Alabama hospitals are in dire need of a rescue, losing money at an alarming rate, according to a recent study.
Everybody around the country's had difficulty, but Alabama has been worse than everybody else.
Dr. Don Williamson of the Alabama Hospital Association says that since the year 2020, Alabama hospitals have lost well over $1.5 billion. Williamson says that if Alabama didn't receive federal stimulus funds, the losses would have been over $2.4 billion.
50% of all Alabama hospitals now are spending more than they're bringing in from operations. So they're spending down reserves. And that's a finite period of time. When you go through your reserves, bad things happen.
The reason for the losses, according to the study, is that salaries of hospital workers went up, coupled with the price of drugs also went up, and patients have come into the hospital sicker than ever before, leading to longer hospital stays. Plus, due to the drop in Medicaid coverages, the number of uninsured patients is also going up, leading some to worry that rural hospitals may be set for closure.
Many hospitals are running at a deficit, and rural hospitals have borne the brunt of some of these short funds. It's a problem that plagues all hospitals, but like I said, especially those that are in some of our rural communities.
Neither Dr. Williamson or Dr. Stubblefield there would reveal which rural hospitals are at risk of closing. But the federal COVID funds that hospitals relied on is running out. So again, that trend of losing money in 2022 may continue in 2023. For now, we're live. Archie Snowden, News 19.